Today I'm speaking with Dr. Laura Fortner. She's an OBGYN practicing in Ohio, and she has over 20 years of experience as a physician. But on top of that, she's created her own coaching program, the Med Mal Coach. And this is because of her own involvement in medical malpractice law. So, Laura, thanks for talking with me today.
I'm super honored to be here. And yeah, I started really out of a stressful time in my life when I was going through medical malpractice myself as a physician and realizing that physicians don't really have resources in this arena really sort of spurred on myself to develop something for physicians to be able to help them thrive through something like that.
Instead of making it taboo, you've actually opened it up to say it's okay to talk about it. So, tell me about that transition and how it led you to creating your own program.
You're right, it's taboo, right? And we're actually even told by our lawyers and insurance companies that we should not speak about it. What they mean is you don't want to talk about the details of the case, but you can talk about what you're going through. And it is known that physicians suffer from what's called litigation stress. The stats show that 99% of us actually will get sued at least once or twice in our career if we're in a high risk specialty, and 75% of those in low risk specialties will get sued. And we're very underprepared as physicians because we're not getting education on it. We've sacrificed our entire life giving to a profession for other people. And then something like this happens. We have a difficulty because we mix up who we are with what we do. And that litigation stress, there's a continuum. So it starts out as litigation stress and then can progress to what's called medical malpractice stress syndrome, which is in the DSM.
Your goal is one on one coaching to help achieve peace of mind, decrease that litigation stress you talked about, and really help speak up about the necessity of medical malpractice reform. So, how did you start this? I mean, I don't know a lot of other doctors who are doing this.
Well, I was hit with a medical malpractice lawsuit about 8 to 9 years ago now, and it is still ongoing for me. Being through the entire gamut of the legal process from dismissal to it coming back to trial to appeal and all the things, I recognized from my own healing, I was just trying to heal myself, Erica. Like I wasn't trying to do anything but that. And through that process, I got life coach certified as well as certified in trauma and really developed peace of mind in the now, no matter what happens with this case that I'm in. And what I recognize is most physicians can't have that peace of mind until it's solved. And the problem with that is most medical malpractice cases go on for 4.7 years is the average time.
So, with your coaching, what can someone expect? So, if they were to go to your website and sign up for the MedMal coaching, what does that mean?
So basically, they first can sign up and just get a free consultation with me. And what that is basically sharing with them the tools and things that I have been able to be certified in to hand off to them to be able to be prepared when something like this happens. So when we get served, they come to your office in front of everybody. Like they came to my home right after the holidays with my kids at the door to serve me papers. And that is traumatic in itself. And that trigger promotes all these emotions that run wild that we don't know how to deal with. And most of us are trained with our training to be able to push emotions down. We got to get back up. One of the tools that I teach is self-compassion. So one of the things I have people do, especially when this happens to them right away and they don't even know how to handle it, it's like, let's stop and let's ask yourself, if this was happening to a friend and a colleague right now, what would you say to them? And say it to yourself.
That's so key, right? Because it's so easy for us to give advice and be compassionate to others, but it's so hard for us to do that for ourselves. I love that you're doing one on one coaching, but I saw that on your website, you also are potentially opening up a group class as well. Can you tell me a little bit more about that, please?
Yeah, so I saw the need, especially because as I'm coaching my clients and talking with them, they want support. They want to know that other people are going through the same thing they are going through because it is so taboo to talk about and no one is discussing it. So I saw the need to have a support network and a support system. And so that will be opening soon, along with there are some people that want to remain anonymous, but they want the materials, they want the tools to be able to heal themselves through the process. And that's what this program is going to do for them, where they could do it on their own time if they feel like they want to try to do it themselves.
Well, you're opening up a field that I wish so many other physicians were already a part of. So thank you for doing something that needed to exist for so long and doing it really well. It was a pleasure talking with you today. Thank you so much.
Thank you too.